Hello, my name is Sydney Bormann, and I will be presenting our project titled Analysis of Age-Related Outcomes for Skin Cancer Awareness and Prevention in Southeastern South Dakota. Skin cancer is the most commonly diagnosed type of cancer in the United States, and rates of melanoma-related deaths are increasing in South Dakota. The incidence and mortality rate of melanoma is higher in South Dakota than the overall U.S. population, and the median age for skin cancer-associated deaths in South Dakota is 70 years. Individuals with fair complexion, family and personal histories of skin cancer, and increased sun exposure are predisposed to skin cancer. 84% of South Dakotans identify as Caucasian, and over 22% of South Dakota's workforce is within agriculture, which comes with increased sun exposure. The aim of our study was to evaluate and raise awareness surrounding skin cancer prevention and risk factors among community members at local county and health fairs in southeastern South Dakota. We hypothesized that there are significant differences in skin cancer practices across various age groups. For our project, we administered a 15-question multiple-choice and Likert scale survey assessing skin cancer prevention techniques, sun exposure, and skin cancer history to community fairgoers at 3 events. We also distributed educational materials on safe sun practices, as shown in Figure 1. For our results, the survey was completed by 92 people with a median age of 49 years. 76% of respondents were female and 22% were male. 11% reported a personal history of skin cancer and 14% reported a family history of skin cancer. 64% have had their skin checked by a healthcare professional, and 16% had suspicious skin lesions they were concerned about. The median amount of occupational sun exposure was less than 30 minutes, and respondents reported a median sunscreen use of 50% of the time. Notably, over 20% of respondents reported more than 2 hours of daily occupational sun exposure. 37.6% reported wearing sunscreen, and less than 30% reported wearing sun protective clothing often or always. 36% of respondents reported feeling confident or extremely confident in their ability to self-assess their skin for concerning lesions. We found no significant association between wearing sunscreen and occupational sun exposure or a personal or family history of skin cancer. Some geriatric considerations we identified include our data supporting that people tend to wear sunscreen less as they age, even though the incidence of skin cancer increases. As people age, they should make a continued effort to wear sunscreen, hats, and other sun protective clothing. Also, we must continue to educate the public on self-assessing concerning skin lesions and promoting discussing skin examinations with their physicians. Thank you.